But what if your real problem is that you wake up exhausted, you're chronically stressed, you haven't gained muscle in years, and your testosterone is tanked? If that's the case, then tracking blood sugar alone isn't enough. High blood sugar, the root cause might have nothing to do with what you're eating. I'm Dr. Adam. I'm a naturopathic doctor and a men's health coach. I work with men over 40 to reverse type 2 diabetes, optimize testosterone, and restore energy using a data-driven approach. If you've been doing everything right, low carb diet, regular workouts, but your blood sugar still won't budge, stress, cortisol, and poor sleep might be silently sabotaging your progress behind the scenes. And I know this firsthand. I'm a type A guy. I struggled with anxiety for over a decade, and I pushed myself to the point of even developing an autoimmune condition called Hashimoto's. So if stress feels like the missing link for you, I get it. But the good news is you can fix it. I've done it. And in this video, I'll show you exactly how I've helped dozens of men break this exact cycle too. So let's break it down, starting with your cortisol, your body's main stress hormones. Here's what tends to happen. Chronic psychological stress leads to elevated cortisol, and elevated cortisol raises blood glucose levels to fuel your fight or flight response. That's adaptive in the short term. But when stress is constant, your blood sugar stays high day after day. That's when it becomes a problem. There's a study published in the Journal of Clinical Endocrinology and Metabolism that showed how chronic stress can significantly raise fasting glucose and impair insulin sensitivity, even if you're not overweight. Yet most men think that high blood sugar is just about eating too many carbs. That is the blind spot. Cortisol might actually be running the show. Now, here's the kicker. Cortisol and testosterone are biological opposites. When cortisol goes up, testosterone goes down. And it's not just emotional stress. So sleep deprivation is also a stressor too. Just one night of under 5 hours of sleep can drop your testosterone 10 to 15% the next day. So low T is not just about your age. It's about how you recover. Then low testosterone leads to less energy, more cravings, poor decisions around food, less motivation to train, which spirals into even more stress. So what happens? Well, the classic presentation of chronic stress is that you feel wired but tired. So you skip your workout, you eat whatever's convenient, and then the stress builds. Your glucose spikes again and again, and then you lie in bed, but your brain won't shut off. It's just this brutal spiral. I've been there. And the worst part is that most doctors just glance at your A1C and tell you to cut carbs, eat less, move more, that kind of nonsense. But what if your real problem is that you wake up exhausted, you're chronically stressed, you haven't gained muscle in years, and your testosterone is tanked? If that's the case, then tracking blood sugar alone isn't enough. In my practice, I track everything: sleep and stress, testosterone, muscle mass, glucose. Because when you hit the real cause, results come faster. It feels easier to reverse this disease, and then results actually last because you're in charge. You're not dependent on meds doing the heavy lifting. So at this point, you might be thinking, stress is unavoidable, right? So what? Am I just doomed? Well, absolutely not. You can't eliminate stress. That's true. I'm assuming you're a busy professional. You're juggling work and family and health. Stress is just part of the game. Mine too. But your response to stress, that changes everything. Cortisol doesn't spike just because of the stress itself. And this is key to understand. Cortisol spikes when your brain perceives the threat and keeps the alarm on, even when the danger is long gone. So sometimes there's no real threat at all, and your brain just misreads the situation. This misfiring system, your brain's survival software, is outdated for modern life that is just bombarded with stressors and threats. I had a client who was checking all the boxes to reverse his diabetes, but still had an A1C over 7%. It was 7.5. So technically still uncontrolled. And when we did some digging with more detailed blood work, his AM cortisol was just maxed out, and his testosterone was in the bottom 10 percentile for guys his age. Hard to say exactly which one came first, but when we discussed his sleep, it was clear that the high stress levels from his job were following him home and then interfering with his sleep quality. So there's the missing link. So eating lower and lower carbs wasn't the solution. Managing stress and fixing sleep was. So how do we do that? What do we do with all that stress? Well, the first tool I recommend is your breathing. And I know it sounds soft, but your breath is the one thing you can immediately control to tell your body you're not in any danger. And that's important because a stressful situation makes your breathing shallow without you even knowing it, which then signals all sorts of warning sirens throughout your body, which is what we call the fight or flight response. And you can turn these alarms off, tell your body that you're safe by simply focusing on your breath, by extending the exhale. So your exhale is a second or two longer than your inhale. And this tells the rest of your body that the coast is clear, the threat is gone, which is pretty wild, right? Any breathwork helps, but I recommend you try something like the 4-7-8 method, where you inhale for 4 seconds, hold it for 7, and then exhale slowly for 8. Ideally practicing 2 to 3 times per day, especially before meals or bed, and then applying when you're in a stressful situation. So research shows this can lower cortisol by up to 20% in just a few minutes. And just to emphasize, in my experience, this needs to be practiced and applied, meaning you practice breathwork while you're not stressed and then apply it in a situation when you are. Okay, step 2 is to reframe the stress. So stress is largely perception. This is one of the most important concepts that I've learned about my own mental health. It's not the stressor itself that's the problem. It's how I perceive it that matters most. One trick here, one reframe, is to ask yourself, is this a threat or a challenge? And here's what I've learned after doing this almost daily for the last decade plus, that most things in life aren't threats, at least not to my safety. When you reframe stress as a challenge, your body actually shifts. So less cortisol, more testosterone. And especially if you take action and navigate the challenge well. As you can imagine, doing the opposite, avoiding the stressor will only make your perception that the threat is actually worse. So there's research that shows that people who view stress as growth-oriented opportunities will experience better health outcomes across the board. And that's even under pressure. So it's pretty effective. Okay, the third tool to actively manage stress is to walk it off. Literally, a 10-minute walk after a stressful moment or after meals can blunt cortisol and reduce glucose. And we know that something as simple as a quick walk can reduce inflammation and promote better sleep. It's a multi-tool. For an added bonus here, you can walk outside, which also increases dopamine levels. This winter in Montana, I challenged myself to walk outside on the coldest day of the year. And so really there's no excuses for me at this point. It's simple, it's obviously free, and it's super effective. So there you have it, the cortisol, sleep, testosterone loop silently driving high blood sugar in men. If you've only focused on diet, you're missing the real picture of metabolic health.